You know it's bad when the government is issuing warnings about illicit drugs.
Chicago's biggest music festival is underway. Chopper 2 was there as the gates open for Lollapalooza. Tens of thousands of music fans are gathering all weekend long in Grant Park. And this year, organizers are putting a special focus on safety. The Chicago Department of Public Health is warning about fentanyl and the risks of dangerous overdoses. They announced on Twitter fentanyl is found in multiple drugs, not just heroin.
Every year, Lala is a surge of people into emergency departments, especially young people in Chicago, because they've experimented at a time when we really just want people to have fun, but have fun safely.
One Chicago DEA agent said in a Fox 32 News report, Lollapalooza is like Christmas for drug traffickers. Fentanyl, what is it, and why you should be concerned, and what's being done in the State House. This is Capital Crimes, the crimes behind the legislation. The story. Though seemingly new due to the number of stories in the news and the media, fentanyl has actually been around for some time. It's a synthetic opioid like tramadol and methadone, having been created for the treatment of pain relief. It's a potent drug, about 100 times more than morphine, and 50 times more than heroin. Like other pain relievers, effects include relaxation, sedation, drowsiness, and euphoria. When it's taken as prescribed, some of its more negative effects include nausea, vomiting, urinary issues, and issues with your eyes and respiratory system. While it's taken on its own, which can result in overdoses like you see with hydrocodone and other opioids, it's frequently being mixed in with other drugs, oftentimes unknown to the user, and that can end in tragic results. State Representative Patrick Windhorst.
Fentanyl is a synthetic opioid, which means it's essentially man-made. It's a painkiller. It is used in medical settings for pain management purposes by physicians and medical professionals. But it is also prevalent on the street and finds its way not only on its own, but as something contained in other drugs. In fact, it's common for other drugs to be laced with fentanyl or have fentanyl components in it, which can lead to unintended overdoses, or not that an overdose is ever intended, but an unknowing, but maybe better than unintended, unknowing overdose, where an individual thinks they're taking one substance and taking that substance at the quantity they would normally consume it, but that substance contains fentanyl, so it causes an overdose because it's just too much for the body to take. Now, fentanyl as an opioid is a suppressant, so it would suppress breathing, suppress bodily functions, and that's what causes the death. Yeah.
According to a report by the National Center of Health Statistics, the rate of overdose deaths involving fentanyl spiked by 279% between 2016 and 2021, from 5.7 per 100,000 to 21.6 per 100,000. It went on to include that from 2019 to 2020 alone, the rate of deaths linked to fentanyl rose by 55% and by 24.1% from 2020 to 2021. And according to the DOJ's Drug Enforcement Administration, there has been a shift from a heroin-based market to a fentanyl-based market. Rockford State Representative John Cabello has a unique perspective, as he's also a police officer.
Well, it's obviously a horrible situation. And look at the amount of people that are dying by one use of fentanyl. And it's such a small dose that can kill you. If you don't know it's there, you're going to be in some trouble. A lot of times the Narcan's not going to save you. So a lot of people have a false feeling that, oh, well, if I do get some fentanyl, that Narcan will save me. It's not. No, it's not going to do it. First with heroin, we were having, 300 and some odd people dying a year just on overdosing from heroin. So now, the numbers I'm sure have, now that they're testing to have fentanyl within that heroin or the crack cocaine or the other types of drugs that people are using, prescription drugs even. Some of it has fentanyl in it now because they're buying it from places that they shouldn't be, and they don't know what they're getting. And I mean, it's a bad thing.
One of the amazing things about fentanyl is its potency. Just a 2 milligram dose is enough to kill a user with zero tolerance, while with heroin, 60 milligrams of heroin is considered a lethal dose. House Minority Leader Tony McCombie, who lives in northwestern Illinois, is seeing its effects in her district.
Yeah, unfortunately, as a matter of fact, I am. We have had friends that have had children who have had drug issues in the past, and may try a drug of their choice, not realizing that there's fentanyl in it. And like we've talked about many times, it could be, the tip of a pencil, and that's not much. And
so is Representative Windhorst.
I know of individuals who've overdosed that knew them from their prior involvement in the criminal justice system. Some that just knew wherever they were in the community. We've seen issues where young people have accidentally been exposed to fentanyl and have caused, well, not a fatal overdose, caused an overdose, caused considerable health issues. What those long-term health issues are, it's really too soon to say. I believe the public is heightened in its awareness of the dangers that fentanyl would pose.
A big fentanyl bust at Midway Airport Tuesday. Federal law enforcement say they arrested 2 men who had 44 pounds of fentanyl packed in their luggage. Agents arrested 24-year-old Robert Lewis and 26-year-old Jameer Hollingshed. Now, these men had flown in from Los Angeles with the fentanyl in their checked luggage, according to police.
While the drug is arriving in the states through the southern border, Mexico isn't the only source. An ABC 7 story on how China is in the mix.
There is a kill chain that begins with China and ends in the Cook County morgue, according to Northwest Suburban Congressman Raja Krishnamurthy. His Select House Committee on the Chinese Communist Party has now issued a new investigative report.
The CCP provides government subsidies to PRC companies that manufacture fentanyl analogs, precursors, and other synthetic narcotics, so long as these companies sell them outside China.
And Chicago's not the only entry point in the state. Massac County State's Attorney John Stratmeyer on how it's working its way into far southern Illinois.
Of course, nationally, I do believe it's coming across the border, the southern border. How it's matriculating to Massac County and some of our smaller communities, I don't know for sure. Some of it is believed to be mailed in. Some of it is there are people we believe that are making runs to larger cities, larger metropolitan areas where they have contacts, and bringing it back to this area for sale.
The Drug Enforcement Administration says last year it seized enough fentanyl to kill every American. Across the country, the DEA seized more than 77 million fentanyl pills and nearly 12,000 pounds of fentanyl. 7 out of 10 pills tested by the DEA last year contained a potentially deadly dose of fentanyl. Just 2 milligrams could kill someone. Some of the fentanyl seized was marketed as other drugs.
18 million pills have been seized already in 2024, and 18,000 pounds of powder has been seized already at the border in 2024. So, you figure that's going to take that times 4, and we're on a really bad path. It's not stopping.
From what I understand, what I've been told, the border is an issue, but a lot of the times they're actually bringing it through ports of entry, meaning they're disguising things they're bringing into the country, but inside of that, something that looks like a lawful product being brought in actually contains illegal drugs such as fentanyl. We have seen a huge increase in the number of overdoses, particularly fatal overdoses. That number has skyrocketed since the COVID pandemic. Basically about 2020, we've seen a large number of fatal overdoses. And so that creates a crisis in our communities where we see people who are dying at young ages, who are And then oftentimes before even they have the fatal overdose, they're getting addicted to drugs.
Courtney and Tom, Athens Clark County Police say this woman, 59-year-old Pamela Graves, was babysitting a 15-month-old little girl when that girl died from exposure to fentanyl and other drugs. Now, Ms. Graves is here at the Athens Clark County Jail on drug charges and a charge of felony murder.
In addition to the illicit use by adults, children are now being caught up in the epidemic. A 2023 study found that between 2005 and 2018, more than 700 children under the age of 5 died as victims of poison-related fatalities, and a large percentage of those were from opioids.
A 1-year-old is dead and 3 other children sickened after suspected fentanyl poisoning at a daycare facility. One of the victims, a 2-year-old, is now fighting for his life. 2 people have been arrested on murder, manslaughter, and assault charges.
A study by the medical journal Pediatrics went on to include in its findings that as it became more difficult to get prescriptions for standard opioids, people began turning to heroin and fentanyl. And as they're often obtained illegally, they aren't subject to strict packaging laws, which can in turn make them easier to access by children. The legislation. One of the challenges in addressing the epidemic is that some of the laws that are already on the books don't apply or fit the situation. Representative Cabello.
This is relatively new, the drug, fentanyl. So I think that's the reason why we're trying to do it. Crack cocaine was like that. When they first came out with it, it was killing people on the first use, but not as many people as fentanyl is killing. I mean, geez, I think they're saying it's a plane full of people every week that are dying off of just fentanyl. So it's something that is worth trying to enhance penalties for.
With that, Representative Cabello put together House Bill 2414.
It increases penalties by 3 years for a minimum sentence and 10 years for a maximum sentence for the knowing manufacturing or delivering or possession with the intent to manufacture or deliver 15 grams or more of any substance containing fentanyl. And I mean, that's still a huge amount. The stuff that what can kill you from fentanyl is what you can put on the top of a pin.
For those who expose children to methamphetamine, I proposed a bill, House Bill 4151, that would increase penalties for those who expose children to fentanyl. Right now there's a gap in the law. It's not clear that there is coverage other than endangering the health of a child, which I think fits, but it's a lower level punishment. And if it doesn't involve a death, it would only be a misdemeanor. So my bill would increase the penalties and make it more appropriate and in line with the methamphetamine child endangerment statute.
In an effort to minimize fentanyl's impact on children, Representative Windhorst introduced Bill 4151.
There was an incident in Massac County that I was made aware of that where a child was exposed to fentanyl and had an overdose. It was not fatal. The state's attorney there looked for charges to bring against the individuals who exposed the child to the fentanyl, could only find the endangering the health or life of a child statute, and then of course saw that there is the methamphetamine child endangerment statute, and the natural question is why isn't there a similar one for fentanyl? So with that, we drafted a bill and filed it. It's going to make that more difficult, I believe. The other area we've know of cases where young people have been, very young people under 13, have been exposed to fentanyl accidentally. We have in our law a methamphetamine child endangerment statute that provides penalties for those who expose children to methamphetamine. I proposed a bill, House Bill 4151, that would increase penalties.
Some bills have already worked their way through the Capitol and signed into law, including ones that mandate drug education in schools. Leader McCombie also had one of hers put on the books.
Yeah, I think there's certainly things that we can do and have done and are starting to do in incremental. Last year I passed a bill that would allow health departments to be able to give out strips, fentanyl testing strips, and also, oddly enough, to take it off of the drug paraphernalia list, which is odd that it was that way. But this year, we also just passed 3350, and that would allow those health departments to actually get out into the world, not just give them out for free in the health department, but maybe go to a high area where they know there's kids using, or in an area that they just think it might be beneficial.
Outcomes. In April, California alone seized 1.1 million fentanyl pills across San Diego County and the border. Also in April, in Washington State, 1 baby died and 2 overdosed in separate incidents where fentanyl was left unsecured. Representative Windhorst's and Cabello's bills are still waiting a committee hearing. For Capital Crimes, this is Dean Abbott.